How long does it take for an implant to turn into a tooth? It's a common question that we get. It's changed over the last 10 to 15 years as well. And so there's a lot of confusion. There's a lot of disparity between different providers. The short answer is that when I started 15 years ago placing implants, it would take us a year, maybe even a year and a half before the tooth would be placed on an implant. The reason for that is that we would take out the tooth, we would bone graft that area, we would wait 4 to 6 months for that to heal. We would put the implant in that bone, and then we'd let that heal for another 6 months or so. And of course, it takes some time to build a tooth on top of it as well. So you're looking at a year, maybe even longer. The reason why it's a lot shorter today is that we have some more data and more science on how implants heal. We know that some implants can be loaded immediately. We know sometimes that those implants can be FDA approved for 6 weeks. The typical strategy here at our office is if you have a tooth in place and we need to replace it with an implant, is that we would like to do what's called an immediate implant. We'd like to take the tooth out and then put an implant in at the same time using the native and natural bone that's there, and then go ahead and let that heal up for 3 months and put a tooth on top of it. Now that process is going to be 3 to 4 months long to do that. Let's say we didn't have enough room, or let's say there was something in the way, whether it's a sinus or a nerve, and we couldn't do an immediate implant. We could take that tooth out, we can bone graft that area, let that heal up for 3 months, put the implant in, and then let that heal for another 3 months. So we're looking at closer to 6 months for that implant to be ready to put a tooth on top of it. But the good news is that you no longer have to wait a year and a half for the average case to get an implant.